regarding anatomy. Myself, Dr. Joshi here, telling you about the anatomy and bones. So we know that upper limb, lower limb, and all central skeleton, axial skeleton, what it is called as axial skeleton and appendicular skeleton. These are the two parts, or it is also called as classification of the skeleton. So there are 206 bones basically, as you know. We will take today the lower limb or appendicular skeleton. This is the femur. Okay. So this is the femur, and it is the longest and strongest bone in the body. It is also called as thigh bone. So this is the femur. Femur has upper end, lower end, and a middle part called as shaft. So this is the femur. Femur is very strong. It is the longest and strongest bone in the body, and it has upper end, lower end, and a middle part called as shaft. Again, let us explain the upper end. Upper end has head, then the neck is here. Head is rounded, or it is also called as spherical shaped, and there is a one depression called as fovea here, where the ligamentum teres is attached to this fovea, and there is a neck. This is a 3.7 centimeter long neck, which is present obliquely, and just continuation of the head is called as neck, and continuation of the neck is called as the shaft. This is the total portion of the shaft. The portion between the upper end and lower end is called as shaft, and there is a greater trochanter. You can see here the greater trochanter, and this is the lesser trochanter of the femur. It is also called as thigh bone. I will explain you. And this is the anatomical position. It is the left-sided femur. This is the why it is left-sided femur, because first of all the head lies medially. So we can directly say that here there is a head lies medially, and anteriorly the shaft is convex. This is the shaft portion between the upper end and lower end, and this is called as convex portion. Okay. Then the last is lower end. Lower end has medial condyle, here medial condyle, and lateral condyle, and intercondylar fossa. So these structures are present posteriorly. It is directed downward and backward. These both the condyles are directed downward and backward. It's very important. So they are always lies posteriorly, downward and backward. So we can say that the linea aspera, third point, linea aspera, which is the posterior border, which is the thickest border in the femur, so it is always present posteriorly. So we can directly, linea aspera is present on the posterior side, head lies medially, and both the condyles are directed downward and backward. Shaft is convex anteriorly, so we can identify whether it is a left-sided or right-sided portion. And side determination, this is called a side determination. This is about the side determination of the femur. Okay, so thank you very much, my dears. We will explain in the next lecture.